The vertebral arteries begin in the neck at the subclavian artery and ascend vertically through the transverse foramina of the cervical spine. They can be divided into 4 segments. The vertebral arteries curve around the atlanto-occipital joints to enter the cranium through the foramen magnum. The 2 vertebral arteries course along the medulla oblongata and unite ventral to the pons, forming the basilar artery. The vertebral and basilar arteries give rise to several pairs of smaller arteries that supply the cerebellum, pons, and inferior and medial surfaces of the temporal and occipital lobes. The 4 major pairs of arteries are listed in order from inferior to superior. Posterior inferior cerebellar, PICA. Anterior inferior cerebellar, AICA. Superior cerebellar, SCA, and posterior cerebral, PCA. Located between the anterior inferior cerebellar artery and superior cerebellar artery are many tiny perforating pontine vessels. The posterior cerebral arteries can be divided into 4 major segments: pre-communicating or peduncular, ambient, quadrigeminal, and calcarine. The pre-communicating segment is a short segment that extends laterally from the basilar bifurcation to the posterior communicating artery. The posterior communicating artery forms a connection between the posterior cerebral artery and the ICA. The ambient segment courses posteriorly in the ambient cistern around the midbrain, and then continues as the quadrigeminal segment, located within the quadrigeminal cistern. The calcarine segment is located on the medial surface of the occipital lobe. The distal posterior cerebral artery frequently divides into many branches, including several temporal and occipital arteries.